In this episode, we're exploring why great health tech products often struggle to achieve commercial scale. To help us unpack this topic, I'm joined by Julie Pelta, healthcare commercialization strategist, advisor, and advocate for innovation in women's health. Hey, everybody. Welcome to the Akros Advantage. I'm Demi Radeva, and I'm here joined with Julie Pelta today. She's an expert in commercialization. She's an advisor and an advocate in women's health. And today we're going to be unpacking why great health tech products often struggle to achieve commercialization and commercial scale. Julie has spent years helping healthcare organizations navigate the complexities of commercialization, growth, and market adoption. And I'm really excited to have you join me today. Julie, can you tell me in your own words about your experience?
Sure. So I've been in healthcare and sales for 30 years now. And it's changed a lot. I was trained very traditionally in Johnson & Johnson, so sold medical devices, and we had a very solid, proven approach to go-to-market in J&J, which interestingly I see flows through into what I see today with startups. One of the challenges with startups that I think that I'm seeing is around their go-to-market strategy. I think that everyone falls in love with what they do. You get very tunnel vision in your solution or your service, your product. Literally, you just, when I do some assessment for Innovate UK, a UK government organization. And so when I do the assessments, when I review what their strategy is, they, in the go-to-market section, will go to the NHS. Will go to the consumer, and there's no detail behind it. There's just an assumption because their product is so great that someone of course is going to buy it, but you don't have to have the best thing. And J&J proved that to me, that they had the best products. They had the best strategy in how to sell. I then evolved my career into doing my own distribution, having products that weren't as strong as J&J, but I knew how to sell them. So you don't have to have the best thing. You have to have a very solid go-to-market strategy. That's your key, which is often missed by most companies at the early stages.
We work with a lot of founders that are very technical founders or academic founders.
Yeah.
They have this passion and obsession with the technology or with the product that they've built. But completely miss the whole idea. How do I actually sell this? What does it take to sell to the NHS? And is there a roadmap and a breakdown? And who are the founders that make it versus not?
So there's no algorithm, particularly in the NHS. So there's a reason that the likes of J&J, Medtronic, I've worked for both of them. I was a consultant for Medtronic. I worked as an employee for J&J and then had my own distribution business. But there's no one size fits all for any trust, primary care. You basically, the blanket approach needs to be that you need to build your sponsors. You need to build your key opinion leaders. You need to, one of the kind of jokes that I have with some of my colleagues in this space is that, everyone starts with a pilot, but there's always the usual suspect hospitals that will do the pilot. Then once they finish the pilot, the company assumes, well, I've done the pilot in the NHS. They're obviously going to start buying this. They never do, because they're just the usual suspects of, will just adopt all sorts of different innovation, try different things. And it's very rare that it then follows through to them actually spending money and purchasing, which means that how do you do it? It's hugely labor intensive. You need people that really understand the market. I would say not just in the UK, but if you're selling into Europe, if you're selling into America, you need people that understand those markets, because you need to be able to forge relationships. And that takes years. I mean, the investment that you need to make in a health tech company, it's not a quick win. So you need to be pretty committed to having the people that will actually get on the ground and have those meetings and build those relationships to be able to get you to that next stage.
For our audience, majority is based in the US. Can you distinguish who the main stakeholders are in the NHS and what is a trust, what is a clinical commissioning group, and who are some of the main decision makers? I personally have worked for NICE in the UK, specifically in multiple technology assessments, etc. So curious if you can give us like the 10,000 foot view of the system.
So all the trusts will have a procurement department. Within those procurement departments, there will be procurement frameworks that you will, depending on your products and services, will have to be on. So that's one hurdle that you have to jump through. But procurement is one very important part of securing your, if let's assume that you're a product, that to be able to get your product into the hospital, you then need your people that are actually going to use it. So historically, when I started my career 30 years ago, it would be the head of department you would go and meet them. You would say, hey, I've got this new product. Would you like to try it? Yeah, let's do it. Head of department would declare, this is what we're doing. And then it would just happen. Now, procurement steps in, and then we'll start asking some really difficult questions. So in parallel, you need to have the key opinion leader of the user, so the surgeon or the doctor, whoever it is may be using it, and the procurement team kind of in lockstep, that you're going to be able to then move it forward into purchase. Because the thing you have to think about is, how do I actually make money? And as much as, I've been in situations over the years where the surgeon would say, yeah, I want to use that. And then you roll into the hospital. I remember I had a capital piece of equipment, and this was like 20 years ago, and it was so heavy, and I dragged it through the hospital and I was ready to go, and procurement literally turned up on that day and said, who are you? Yeah, go. Because we hadn't ticked that box. So you don't miss that box. In terms of primary care, I mean, there's so much change going on in the UK now. Our government is doing all sorts of weird and wonderful things. But ultimately, it's kind of the budgets are held by the locale of each, that is then connected to the hospital as well. So you really have to have someone that actually understands the market, because it's changing so rapidly. I mean, I'm sure in the US, it's a pretty complex market as well, right? And everyone thinks that the NHS is some kind of like golden egg where, if you crack it, but back to there's literally no algorithm. Like, it can be just the strangest path that you get to funding. In terms of funding, again, if you take a product, so there's coding, which I think you probably have in America. Yeah. So there's HRG coding. So if you can fit your product or service into a coding system, that's how you get reimbursed. If you have something that doesn't fall within the codes, you've got a problem, and find a way. Otherwise, to create that is a journey, which you may not have enough money to do. So
when it comes to navigating procurement, is it completely different from trust to trust to trust, or are there commonalities, and are there some check marks that you can give us of, if you have these 4 big things, it would help speed up the process? What are they actually looking for? In my experience, procurement is just a risk mitigation.
True.
They're just trying to check some boxes so that they can get you to that next level. So can you speak to that?
I mean, back to the coding. So you make procurement's life significantly easier, not least because the coding is how they access their funds back to the hospital. So check that box, everyone is happy. So you need to have stakeholder buy-in. So, and as senior as you can go, but I just wouldn't isolate it to one person anymore. It rarely is. So, if you look at the holistic team of everyone that this service or product touches, and every senior and then mid-level and often junior person, you can't ignore anybody, because everyone has a voice in that cohort.
So it's a committee decision.
Yeah. So like the concepts and treatments of multidisciplinary teams. So you would have a similar kind of challenge in terms of how do you get your products or service in? There's always a committee. So the NHS is kind of geared for a big group of people that make a decision. So you need to make sure that you can demonstrate a champion. So that's the checkbox. And they can be multiple champions. So you've got procurement, you've got the champion. I think as well, it's not necessarily a checkbox, but I think that there's a trend of people kind of, this is working here. So if it's AI based, right? So if you put AI in anything right now, people seem to listen to you. The challenge that you have, I think, is how do you actually demonstrate value? So it may open doors for you. And I don't know if maybe I'm being unkind, maybe it shouldn't necessarily be in the checkbox, but I think it might get you meetings.
Okay.
But if you're going to go in with kind of an AI based solution, which is kind of de rigueur right now, be very robust in the value that may bring. So how are you saving money, saving time, helping, whatever it is your solution is doing, think about what is important to the person that you're speaking to. So with procurement, particularly, if there's no coding, you're going to increase their budget and a headache yeah, good luck with that.
In the US, two of the main hurdles, especially when it comes to AI, one is the data, and then two, it's the workflow.
Yeah.
Does it change the clinician's workflow? And then what kind of data have you trained the models on? And do you need access to the data of whether it's the hospital or the payer, et cetera? What are some of the biggest hurdles and how can a founder navigate those?
Use a partner or have someone in your business that is an expert in that. So I'm a big fan of swim lanes. I talk about it a lot with my team. And I think that what I see as well, particularly in the startup world, is that everyone with the best will in the world can do their research, do their reading, think that they understand it. But, you know, you can save a hell of a lot of time by having the right people in your team with the right expertise. So when you have someone and you're having to deal with the data, have someone that really understands that in that specific market. And they're out there. I think the challenge is, do you have the funding to be able to support that? And that's, I think for startups as well, you are kind of bootstrapping a lot of things, not least kind of the workflows, and that as well is somewhat of a challenge, I think, for startups.
So what barrier are you solving for? Is it an access barrier? So if a company works with you, you're able to help get them that access? Is it helping clean and understand the data so that it actually fuels a better AI model?
Yeah, I mean, so everyone wants to use AI, but the before you even go there, you have to fix your foundations. Like the foundations are key. And that's the data. So where DataArt would come in, or companies like ours will come in, would be around being the experts in the tech. We are partners with, there's a ton of stuff on the market with Databricks, with Snowflake, the clouds, they all have services and offerings, but to be able to navigate that yourself is challenging. So where you would work with a company, advisory company, consultancy company, to help you navigate, actually, how do we do this as efficiently as in a most cost effective way with actually key outcomes. And the key outcomes are, get me to be able to build my agentic model, get me to the point of, outside of startup world, one of the things that we're seeing in the market more broadly, kind of with the larger companies, is that everyone's off different departments doing different projects with, agentic here and AI there. And the money that they're burning on the tokens is insane. Everything's not everything. A lot of things are being capped now because the boards are saying, well, wait a second. How is this actually helping my business? How are you actually getting me to revenue? So what? And so there isn't this kind of holistic approach, which is, again, back to the foundations, as much as it's relevant to the startup, like kind of full circle, that you have to make sure if your foundations are solid, if you're a startup, you're in a much more advantageous position because you're early stages of that to be able to do that. But the large companies are also in the same position right now. It's harder to move that big ship. So with a startup, you're kind of in a positive position to be able to do it properly from the start. And that would be a strong recommendation, is to look very carefully at kind of how you navigate that.
Do you work across all of the EU or just in the UK?
So we're a global company.
Yeah. Okay.
So we work, our markets are predominantly Europe and North America, but we have some business in APAC, some business in South America. We recently acquired a company in Chile. So, we have a footprint, but the majority of our business is Europe and North America.
And are the data issues pretty much the same, or do you see some very distinct challenges in those markets?
It's interesting because we work across verticals. So healthcare is a really big vertical for us, but we also work extensively in finance, retail, media, travel. It's a similar problem across the board. Like, when we have a data lab and our colleagues come in when we start the conversations about kind of all sorts of different weird and wonderful things that our clients want to do. And it's often, we're looking at, with the larger companies, it's often system modernizations. Larger companies make acquisitions. There's kind of disparate data points, disparate systems, and you have to bring that all together. But there's nothing really terribly unique about the problem that people are currently facing. I think that it was a little bit Wild West it still is a little bit Wild West with AI at the moment, of like everyone's like running off doing these weird and wonderful things. But I think that the data lab for us is interesting. Kind of AI lab super busy, data lab consistently busy. And now that's starting to shift more as people are starting to understand, like, how much have you spent on this kind of AI experimentation? And actually this realization, you've got a lot more people in roles. I was in an event last week around AI responsibility. So kind of the governance, all of that. And it all links to how are you actually using your data? What does your data look like? And it's often consistently across the board quite messy, me sorting out.
You're a femtech advocate. Do femtech builders face the same challenges, and what advice do you have for them?
I mean, like, different challenges, right? Like, not least female founders are less well represented, less well supported. Hopefully that will change. I mean, there are certain companies that do more than others, but I've been involved with a company that has a wearable, not medical grade, but for women that suffer from hot flushes and menopause, and was working with them in trying to kind of have some conversations around B2B. And what was super interesting for me is that every large company has a fund for, so you know, have standing desks, you have desk fans. And I tried to engage in those kind of heads of people, HR conversations, and it was just, I was hitting brick walls constantly. It was just not, you know, although people are starting to talk more about menopause, it's just hasn't really been adopted in terms of turning that into true funding, like dedicated funding. And so that's an uphill battle. I think that the femtech space has some really exciting, I'm working with another company that is a wearable for hormone monitoring, and can look at all sorts of issues around kind of hormone monitoring for women that are suffering from PCOS, you know, women that unfortunately suffer from miscarriages, early stages. But again, it's, you know, trying to break through into kind of that funding journey seems to be more challenging. So I think my recommendation on the femtech side is get some allies, align yourself with people that really understand the funding space, the funding market. There is a way through, but it is challenging. It's not a great message, right? But that's why I'm passionate about it, because I just think it's not served as well.
And how about the data in the space as well? I keep hearing that there is a lack of data and understanding of actually women's bodies. And given that you're so deep in the data space, what challenges are you seeing, or maybe that are coming down the line?
If we kind of move into women's health data, I think it's just patient data full stop is
just a lack of.
Well, it's getting consent, willingness to, the ability to use the data. You know, a lot of people will in their business plans say, well, you know, I'll collect all this data and that's how I'll monetize it. And it's like, well, you know, that's all well and good, but the permissions that you need to get to do that are often missed as well. Like, I was speaking to a pharma company that was actually in kind of the femtech space, and they have reams and reams of data from clinical trials, but they have to bin all of that data because, like, historically, only now is this conversation happening. They never got consents. And it's not just consents from the patient, it's consent from the hospital. The term foundation, I guess, is the theme here. So not least kind of make sure that your data foundations are strong, but, you know, you make sure that your compliance and governance and permission strong foundations are strong as well, because that will set you back massively if you forget that, if you miss that.
Is there anything that I didn't ask that you'd love to share with our audience?
Yeah, don't get lost in, don't get lost in AI at the moment. Like, there's a lot of noise and there's a lot of changes that are coming on, not least for the larger companies. There is an expectation that you will demonstrate use of AI in what you do as standard, right? So you need to demonstrate that. Where that then ends up is unclear to me, based on the fact that I don't think companies are understanding the value of it right now. So if you can demonstrate a route to revenue, the so what, I think that will put you in a pretty solid position in conversations, at least with potential partners or acquirers.
On that note, thank you so much.
Thank you.
I really appreciate it. Thank you for joining us for this episode of the Akros Advantage. Healthcare is one of the most complex industries in the world, and every conversation in this series explores a different piece of that puzzle, from innovation and patient experience to commercialization, investment, and systems transformation. A special thank you to our guests for sharing their expertise, experience, and insights with us. If you enjoyed this conversation, be sure to subscribe, follow along, and explore additional resources from Akros Advisory, including our newsletter, where we help healthcare innovators navigate the path from idea to impact. Until next time, keep asking better questions, challenging assumptions, and building solutions that create meaningful value for the people they serve. I'm Demi Radeva, and this has been the Akros Advantage.